My idea is a material-based, resistive, good-looking, brightly coloured and fun chewy for children and young people. Many of the children that I work with have a need to chew or heavily suck on items. These can often be very inappropriate and sometimes hazardous to health. We often recommend, with these type of children, we recommend a chewy as part of their overall treatment strategy. And the ones on the market at the moment are mostly silicone based. But a lot of the children we've noticed like a bit of moisture retention in their chewy, and they like something that they can also fiddle with. So the idea is to fill that gap, to have a good looking chewy that covers the needs that we've seen in the children we work with in Gateshead.
The idea came from some work that I was doing to help patients with dementia come into the cath labs. A lot of them do come in for pacemakers in particular are at the advanced stages, and when we prepare them for the procedure we have to drape them with sterile sheets and it covers their head and goes all the way down to the toes, and they're also on a very narrow table which moves. The camera comes quite close, so that everything about the environment is extremely intimidating. It's intimidating for anybody without any form of dementia, never mind somebody with any type of cognitive impairment. So I got in touch with the dementia care team to look at not just that, but other ways that we could improve the experience for patients with dementia, see if we could reduce the anxiety and help them to get through their procedures in the most efficient and calm way, really. One of the things that they came up with was that it might be useful for patients to have something to hold on to while they're having the procedure, because they have a sense of insecurity if the table moves, especially with it being narrow, and they've got no control over it. So that was the seed of the idea, really.
My idea is using intranasal cooling, using device from Benechil, which is used for cooling nasal cavity in acute migraine attacks. Because this device was used previously and is owned by the company, it was rather a business idea or question initially from thinker or visionary who came up with the question, can this be used for something else? What about headache or migraine?
The staff developed some back problems or musculoskeletal problems. So the back care team pulled an idea together to come up with Patch, which is our prototype solution to help resolve that issue. Patch is a paediatric audiology testing crib holder, and it's a device that's height adjustable and secure to place baby car seats on, so when the audiologists do the test the baby doesn't waken, so it reduces parent anxiety, test is complete, and hopefully reduces musculoskeletal issues that the audiologists have.